giving them. Thank you, Mr. Speaker.
The Honourable Phil Heatley.
Speaker, I rise in support of this legislation and too would like to congratulate the Minister Paula Bennett, her officials and all those who have inputted into this legislation over a long period of time. Disappointed, of course, to hear the calls from the opposition to ask the Minister to front up. The Minister who fronts up everywhere, fronts up in the city, fronts up in the provinces, is fronting up on television, in the House, to small meetings, to large meetings, everywhere and anywhere across the country, and has done for a long time. In fact, we haven't seen a Minister of Welfare front up so much in so many places for so long and talk about the hard decisions. So I would like to congratulate the Minister and also the Minister for seeing this through, accepting where changes were necessary, hardening where it was necessary, softening where it was necessary, understanding that the legislation needs to land where it meets people in a practical way. So this bill does amend the Social Security Act of 1964. It introduces new benefit categories, has a very work-focused approach, and interesting, even the opposition are calling it the investment approach, as they can see too that it is an investment in these people's future, the beneficiaries' future, as much as it is in New Zealand's future. The aim of the bill is to make key changes, probably 5 of them, you could say, a new system of main benefits, to embed a work focus throughout the whole benefit system. The job seeker support benefit replaces the unemployment benefit, the sickness benefit, the domestic purposes benefit for solo parents whose youngest child is 14 years or old or older, and a number of other benefits as well. It delivers a new approach to working with people in the benefit system who are either sick or disabled. It introduces drug testing requirements where a beneficiary is referred to a job or training program where drug testing is a prerequisite. And of course there's financial sanctions if they don't pass that test. And it's just stunning to think that the Labour Party up and down the country are telling New Zealanders, even on television tonight, that it's okay to apply for a job and actually be full of drugs, to have your blood system and breath showing drugs, that it's okay to do that. And the Labour Party is so focused on their philosophical standpoint that they stand in front of New Zealanders and Kiwis up and down the nation and say that beneficiaries receiving taxpayer-funded support, it's okay that their bloodstreams are full of dope. That when they apply for a job, particularly where health and safety is a certain requirement, that it's okay that they have drugs. Now, it's just unbelievable that they think that one could pass the mustard in the court of public opinion. Anyway, go for your life, Labour Party. Keep pushing that barrow. The other aspects that the bill is looking to change, of course, is using the welfare system to reinforce some important social norms regarding children's education and health. For example, children, a beneficiary who has a child needs to ensure that they're enrolled and attending early childhood education, enrolled and attending school when they're 5 or 6, if that's the correct age, enrolled with a primary health care provider and up to date with core well child checks. And we think that's very, very important that those children from beneficiary households get a good start. And last of all, the 5th aspect is stopping benefit payments to beneficiaries with a warrant of arrest that remains unresolved after 28 days. In other words, if you've got a warrant for arrest, the police are pursuing you and you're on a benefit, then indeed with fair warning and you're aware of the situation, certainly be given that chance, your benefit could be cut. And again, the Labour Party are convincing New Zealanders, or trying to have been over the last few months, that it's okay to get involved in crime, to run from the law, to run from police, be involved in serious crime in one way or another, and still receive taxpayer support. Well, good luck with that one too. I wouldn't say you're in touch with New Zealand, but I would say that most taxpayers, those who are on benefits themselves, who lead quiet lives, wouldn't think that it's fair that we should be paying benefits to people who are on drugs and not passing drug tests and are also running away from the law. Mr. Speaker, I commend this bill to the House.
Call Sir William Seo.
Thank you, Mr. Speaker. Labour strongly opposes this bill.